I'm a native of Gadsden, Alabama, which for Alabamians, you would know that's in the northeastern part of the state. My mother was born there, my grandmother was born there, as was my great-grandmother, so that was home for the first third of my life. I attended the University of Alabama and moved down here and spent several years before going to medical school in Birmingham. I spent 10 years in Birmingham, medical school residency, and then I did an additional year of training just in ear surgery alone before moving here to Tuscaloosa. So I spent my life in 3 cities all along I-59, Gadsden, Birmingham, and Tuscaloosa. And I've been here since 1991. I'm married, I have 3 children, but the baby's in college now, so got one more to finish raising. I moved here in July of 1991. Dr. Schatz lured me down here by offering to buy me an operating microscope to use in the office that they didn't have. And having trained with the ear surgeon I did a lot of work under the microscope. I wanted to change from Birmingham, and having lived in Tuscaloosa for a while, it seemed like the right fit, and it has indeed been the right fit for me. I go to Demopolis, Alabama, the city of the people is the translation, every other Wednesday. And I have a clinic there at the hospital, and I see people that for transportation reasons or other reasons choose to stay in their local community, which is fine. And I do surgery down there as well as see patients, in a clinical setting. It's a treat for me to go down there twice a week. I enjoy the drive through the country side of Alabama on the way there and back, and the people down there are real appreciative of Tuscaloosa doctors coming down to that community, so that it keeps their medical community alive just by having providers there locally that they can count on, and they have nursing staff there. It's a win-win for us and for the patients and for the local medical community for us to go down there. It's an important part of my practice and something I enjoy doing twice a month. At our practice, and I won't say this is not true of other doctors, but we make a sincere effort to do the best job that we can for the patient. I know personally I just take a special interest in my patients, and I want them to be glad that they chose to come here when they leave, or they've had an experience here. So I want them to say, boy, I made the right choice to come to Tuscaloosa Ear, Nose, and Throat. We offer a variety of services. We offer general ENT. We do the latest endoscopic sinus procedures. We do hearing and hearing rehabilitation, whether it's hearing aids or a surgical procedure if indicated. And our newest part of the office is our physical therapy area. For many years, we saw patients that had balance problems, many of which were attributable to inner ear problems, but there were other causes as well. And there are really no effective medications to correct those problems. And there is physical therapy now, or there has been the development of new physical therapy techniques to treat people with balance disorders. And just a little less than 2 years ago, we started our balance program, and that's helped patients that really had no other avenue of treatment. It's been one of the best things we've done for the practice since I've been here. But in ear, nose, and throat, we see patients of all ages, from newborn children that may have a tongue-type problem that doesn't allow them to nurse and feed properly, to older senior patients that have hearing trouble, balance problems, and everybody in between. So we really see people literally of all ages. And that's one of the things I like about ear, nose, and throat. It's not pediatric, it's not adult, it's my practice is a blend of everything.